So male voiding issues are a very common problem. Typically, around 50% of men by the age of 60 will struggle with some sort of male voiding issues, and then overall, the incidence is around 80% in a man's lifetime of having some issues with his voiding. They usually present with symptoms such as slow urine stream, hesitancy, meaning we're having to wait for your urine flow to get started, straining to keep the urine going, not emptying the bladder well, and waking up a lot at night. There's often as well some issues with going frequently or going urgently. So typically the evaluation of a man's voiding issues is done with just a conversation, a detailed history of what's been going on with that man, as well as a physical examination. We would also check urine studies for infection or the presence of microscopic blood. We would check to see how well a man is emptying his bladder as well, and at times we will check the flow rate, kind of the strength of the flow, as well as the pressures that a man's bladder generates during his voiding. The treatment options often are dictated by the severity of the issue. Many times men don't necessarily need any treatment as long as their symptoms are mild and there's not further risk being placed on any of their other organ systems. When treatment is warranted, usually we start with a medication, very well tolerated medications that are very effective. However, oftentimes patients either need more than what a medication can do for them, or they're not able to tolerate the medicines, or their condition is severe enough that it warrants more aggressive treatment. And then we have procedures that can be offered to that patient. Those procedures range from things that can be done in the clinic to overnight stays in the hospital. So a lot of men just essentially deal with it, so to speak. They suffer in silence, essentially. So my recommendation to any man that isn't happy with the quality of his voiding would be to, at the very least, speak to his primary care provider, if not seek out a urologist for evaluation. It's very difficult just based on symptoms to know exactly the severity of the issue. So oftentimes it does require further evaluation to know exactly how concerned somebody should be about their voiding status.